Hello and welcome. My name is Carrie Anderson. I'm a physician assistant and I'm the director of the Community Palliative Care Program here at Livingston. Today, I'd like to introduce Susie Woodruff. She currently works for Health Insurance Counseling and Advocacy Program, and they offer free, unbiased health insurance counseling about Medicare and long-term care. She's passionate about helping people make informed decisions about their healthcare needs. She used to work as a career accountant in a certified public accountant firm where she specialized in navigating high net worth clients, many firms, and an international publishing company. Before retiring, she became well-versed with health insurance ins and outs while working for HealthNet for several years. Now she's put on the volunteer hat as the certified health insurance counselor. And today she's here to educate on Medicare transitions. Welcome, Susie.
Hello, thank you very much for that introduction. And I am going to speak about transitioning to Medicare. Mostly, I work with people that are turning 65. So they have a lot of questions. They've received a ton of paperwork in the mail, which they can basically toss out because it just tends to really complicate matters for a lot of people. They get very confused about what they're reading. They don't understand it. They talk to their friends who tell them to get this, to get that. And what you really need to do is, it would be ideal for you to call HICAT and have us arrange an appointment with you, a one-on-one meeting where we discuss what your particular needs are, because your needs are not going to be like your friend's needs. Even though Medicare is basically the same, there's, over 85 million people that are on Medicare. There are specific incidences where you need special counseling and you need to be steered a certain way. So with that being said, I'll get started with what Medicare is. It consists of 4 parts, A, B, C, and D, and it truly is no more complicated than that as long as you understand what each of those are. Part A is hospitalization. And if you have worked for at least 10 years in your life, your Part A is free. It will not cost you anything. There is a $1,600 deduction, but you don't have to pay it. And I will show you how you can get out of that. It's just possible if you have what's called original Medicare only, you will have to pay that $1,632 deduction. What happens is if you are hospitalized, the first 60 days are free in the hospital. So you won't have to pay anything at all. Your doctor's fees, your medicine, any kind of test that you have, that's all taken care of with Part A. If you have to stay there for another 30 days, it's $408 a day that you would have to pay. And if you have to stay there for another 30 days after that, it's $800 a day. So there are amounts that you would have to pay. But once again, if you have certain insurance coverage, you can stay in the hospital for up to 100 days and you wouldn't have to pay anything. So that's basically the hospitalization. You are also allowed 20 days free in a skilled nursing facility. Like for instance, if you were to fall and break your hip, you go into the hospital, you have it operated on, you're there for a couple of days, you come out, you're not quite ready to go home yet. You need some physical therapy, you need somebody to bring you meals and to help you with toilet training and all of that sort of thing. And that can be done in the skilled nursing facility. 20 days you get to stay there for free. If you need to stay there longer than that, it's $100 a day. There are some people that may need to stay longer than the 20-day free period. And if they do, there is an organization that all of the skilled nursing facilities work with that can help you stay a little bit longer. They'll help you file an appeal, and that appeal can get you in there. But generally 20 days is enough for people to get over the hump of the surgery, to the, getting back to your life. So that's Part A, hospitalization. Part B is everything else. That's your ambulance rides, your doctor visits, your lab work, your wheelchairs, durable medical equipment if you need that, mental health coverage, everything else is under the umbrella of Part B. Part B will cost you at this particular moment in time, $175 a month that they will subtract automatically out of your Social Security payment so that you do not have to worry about it. What if you're not drawing Social Security? If you defer your Social Security, you get 8% more a year if you can defer it. Now, when I retired at age 65, I couldn't defer it. That was my only income. So I needed that money. And so I didn't have to worry about my Medicare was taken right out of my Social Security payment, and you just receive the net check and that's it. If you are not drawing your Social Security, you will get a bill every quarter for 3 months worth of your Part B payment, $175. So you'll be getting a bill for $500 every quarter. So keep that in mind when you're planning your cash flow after you are retiring. So that's A and B as far as the cost for B is concerned. And A and B together is called Original Medicare. Original Medicare pays 80% of whatever your bill is. So if you have a $100 doctor bill, Medicare will pay $80 of it and you have to pay $20. That's not so bad. But if you have a $100,000 doctor bill because you've been hospitalized, and we're older, all of us are going to be hospitalized sooner or later, Medicare pays $80,000 and you're on the hook for $20,000. So now we're talking some serious cash. So people do one of two things. They either get a supplemental policy, a Medigap supplemental policy that pays that 20%, or they switch over to Part C, which is an HMO. I'm going to talk about the Medigap supplement first. But remember when we were talking earlier and I was telling you that with Part A, you had a $1,632 deductible? That's if you have original Medicare and you're not getting any help with the other 20%. You will have to pay that $1,600 deductible. So there are a lot of people that pay A and B only. They only want original Medicare. And that's one of the things we would steer you away from, because you're already paying $175 a month for it. And guess what? You can get Part C and it only costs $175 a month. So why you would want to go with just A and B original Medicare, I don't know. I do know actually why people choose that, because when you get Part C, you're in a network of doctors. You can only see the doctors that are in that network. And sometimes you want to see your doctor that you've been going to your whole life. That's a reason why you might want to consider original Medicare, but you got to consider the expenses that are going to be involved with that. So I'm going to talk about the Medigap supplement first. Okay, I need that second picture. The rate. There you go. Thank you. Okay, so the Medigap supplement, these are all of the policies that can be sold in Ventura County. There's a whole bunch of them, from AARP to Washington Mutual to State Farm Auto Insurance, believe it or not, is a health insurance plan. Blue Cross, Blue Shield, there's HealthNet, my old employer that's on here also. There are all these different groups that will be sold to you by a broker. The phone numbers are there to contact the phone numbers. I'll go over what each of these columns are. But basically, the first question that people ask me all the time is, well, which is the best one? Tell me what the best one is. And guess what? By law, they're all exactly the same. So you don't need to stress over which one to get. They're no different at all. There are a couple of little things called the extra plan or the innovative plan that about 4 years ago, a couple of insurance companies decided to offer some extra benefits. Vision, which is one little refraction a year and a discount on some glasses and a discount on one hearing aid. I don't know what that does, but the discount on one hearing aid. And those became different plans. That threw the Medicare world into a tizzy because for the first time, they were all of a sudden adding something different. And they were supposed to all be the same, then they became something different. But they ended up working that out, and they now have to carve themselves out as a separate policy, which is why you see a couple of blue crosses and a couple of blue shields up there, because they offer a little bit extra for that innovative plan. So they're all the same. And if you look at the prices that are established in the different columns under the different plans, you're going to say, well, if they're all the same, why are they charging different amounts? Well, they're charging different amounts because each insurance company underwrites its members. It has a group of members, and that's who belong to the insurance, and that's who pays their rates. Now, insurance companies are in the business to make money. So they take all of their members and they say, well, all of our members have this many things wrong with them, and it's going to cost us this amount of money. And so therefore, we need to charge X amount of dollars to make a profit. And that's what comes out in the rates that you have. Now, I've had a broker tell me, when I say, well, what do I do when somebody, starts shopping for rates? And they said, take the cheapest one. Why? Because they're all exactly the same. So if you get your insurance company and it's raising its rates every year, which it will do every year, your rates are going to go up the older you get. You might as well shop for the cheapest one because you're going to get the exact same coverage. The insurance companies, the Medigap supplements, pay exactly what Medicare tells them to pay. So if you have a problem with something, you are almost never going to call your insurance company. You're going to be contacting Medicare, or you're going to be contacting HICAP, and we can help you with this. But the issues are going to be with Medicare. Medicare has decided it doesn't want to pay something. The supplemental insurance is not going to pay it either. So that's pretty straightforward. Now, as far as the plans that you see listed there, unfortunately, A, B, C, and D, which is what we just learned are the parts of Medicare, are not the same as the A, B, C, D that are plans offered under Medicare. This was established a long time ago, and we just had to learn how to work around the same, letters. Most people, there are still some people that have A, and all these are just different rates for how you are going to contribute each month to what you pay. You have to pay those premium amounts that are there, but in some of them, you also have to pay a deductible amount. F is a plan that you have no deductible to pay on. Unfortunately, you have to have been born before 1955 to qualify for an F plan. Now the plans that most people turning 65 qualify for is a G plan. And with a G plan, there's a little typo on this worksheet. It's $246. It's now $240 for a deductible for G. There's a high deductible G plan, and you see it's only offered under a few different insurance companies. And that one you have to pay the first $2,700, but you can see your rates are only like $41 a month, $56 a month. They're very inexpensive, so it might be worth it to you if you only go to the doctor a couple of times a year for a, get a COVID shot or something, have a well woman check or something like that. It may be worth it for you to pay that high deductible because you'll just get that bill, the 20%, every time you go to the doctor's office until you reach $2,700. And for a lot of people, that works out well. This would be one of the things that HICAP would help you plan for. What's your health like? What's your family health like? How do you feel about your own personal medical care? So that would be, determined that maybe a high deductible G would be better for you. As you can see, the rates change in between F and G and A. They offer different things. K and L are crazy policies. There are only a few companies that offer them. It's a little bit of an insurance product, but you have a very high deductible with that. And with K and L both, what happens, remember the 20% I told you had to pay? K will pay 10% of that, and you're only on the hook for 10% of the deductible. L will pay 15%, and you're only on the hook for 5%. But the amounts are so high, and the dollar amount is almost the same as a high deductible G. I would really not want to, suggest that anybody get into a K and L product. But insurance companies may try and steer you to that. And in is the closest thing to what you are used to for an HMO. Because every time you go in, you'd have to pay $5 or $10 copay with it. And other than that, everything is paid for. Now, when you have a supplemental plan, you can go anywhere in the United States. You can even go over to Europe and get $50,000 worth of coverage in Europe. Let's say you're going on a Viking cruise and you slip and fall and break your leg. You can have that fixed and have medical care over there and be hospitalized up to the tune of $50,000. And believe me, $50,000 worth of medical care in Europe goes a lot further than it does here in the United States. So you can go with a Medigap policy to UCLA, to USC, to Cedars-Sinai, to the Mayo Clinic in Rochester. You can go anywhere you want to in the United States, and you don't have to go to a gatekeeper. You don't have a PCP. You don't have to get authorization. You can call up a doctor and say, I want to come in next week, and they'll see if they can schedule you in. There is absolutely no control over you as a patient seeking the coverage you want or the doctor that you want to see. This is considered the Cadillac of Medicare coverage because you have all the choice in the world. Now you pay for it. We went over the rates. You can see the rates there on the slide. They do go up every year. The highest policy that I ever saw was a 93-year-old woman who was paying $408 a month. So she was paying a lot for her Medigap policy. Now, this Medigap policy is paid in addition to the $175 that's being taken out of your Social Security. So that $175 plus these are rates for a woman just turning 65. So if you're older than that, your rates are going to be different. But and if you're a man, they're going to be slightly different also. But that $170 that you pay plus, $165 for a policy here to start out. Plus, you also have to purchase a separate standalone drug plan, which I'll go over. That's part D for drugs. It'll cost you approximately $350 a month to have a Medigap policy in your old age. And that's going to go up every month as you age. But once again, if it goes up, because you can shop and they're all exactly the same, get a policy that's cheaper because you may like Blue Cross and you think they've been wonderful to you and that's great. But you know what? Washington Mutual may be $100 a month cheaper. So go ahead and shop for the rates. You can actually do it yourself online on the Medicare website, but you can certainly contact HiCap and we'd be able to help you with that. So that's pretty much the overview of the Medigap supplemental plans. So now I want to talk about the other big 20% that's covered, and that's under Part C, A, B, C. And C stands for HMO. It doesn't stand for it, but it's equivalent to an HMO or a PPO. So all of you are probably familiar with this because you've worked for people in your life, and most of them have HMO plans for their made available for their employees. Some of the executives end up with something similar to the Medigap policies where they can go anywhere they want. But staff is usually, relegated to an HMO of some kind or another. There are some very good HMOs around. Kaiser has a very high rating all over the United States. They have the highest rating of any insurance plan around. But there are people that also have a lot of issues with Kaiser and don't like Kaiser for one reason or another. There are many more plans. There are 28 different HMO or Medicare Advantage plans, they're also called, in Ventura County. And you can be signed up on any of them. Now, unlike the Medigap, the HMO plans are all different. So they all have something slightly different. They offer one benefit that another one doesn't offer. And so you really have to call the insurance companies and find out, what do you offer about what's important to you? If it's really important to you to have a membership in a gym, some of them offer and what's called silver sneakers, which is membership in a gym. But there are certain gyms that they use 24-hour fitness, they'll tell you what gyms they use. There are other people that really want in-home support services if they've been hospitalized. So you need to know what's important to you, and then you need to ask those questions of each of the insurance companies that you call. Now, how much do they cost? Remember that $175 that you paid for Part B? That's all you pay for Part C. No more than that. You will have to pay a little copay of $5 or $10, just like with Plan N on the Medigap race that we talked about. But that's it. You don't pay any more than that. And once again, that's taken out of your Social Security if you're collecting Social Security. So you don't need to think about a payment at all on the HMO plans. So what are the two big differences? You have the Medigap policies, which are $300 something a month, and then you have the Medicare Advantage plans that are $175 a month. So that's a big difference. First of all, since you are facing the years with fixed income, what's important to you and how much cash do you have to spend? Is it important to you to have the Cadillac coverage that's very expensive, or can you do with a little bit less than Cadillac coverage, but you're still going to be taken care of? The Medicare Advantage plans, are not going to let you die. If they cannot treat whatever it is you have, they will send you what's called out of network to go to whatever doctor or specialist you need to see. But you should be very familiar with the fact that you can only go to the doctors that are enrolled in the plan that you signed up for. So if you want to see Dr. Smith because your best friend told you, oh, this is the best back doctor I've ever known, he's wonderful, he's great, but Dr. Smith isn't in your network, your insurance is not going to pay for it. If you have a PPO, there's HMO and there's a PPO. They are both under the umbrella of the Medicare Advantage plans, Part C. And a PPO, everybody thinks you can go wherever you want. Well, that's not quite right. You can probably see almost any doctor you want to see, but you have to be very careful. If the doctor says, okay, you need surgery, you have to ask a lot of questions when you have a PPO, because you may find out that your doctor has operating privileges at a hospital that's not covered in your network, and you're going to get a surprise $20,000 hospital bill. The anesthesiologist may not be covered by your network, and you'll get a surprise $11,000 bill. So you need to ask a lot of questions if you're going to get a PPO. And a PPO usually costs a few dollars more a month than $175. There's one that costs an extra $80 a month, and then another one that's only $25 a month. But there aren't that many PPOs offered in Ventura County. There's only 3 of them. So of the different Medicare Advantage plans, there, Blue Cross has one, Scan has one, Kaiser has one, Humana. There are several of them that you can go, United Health, AARP. So there are a bunch of them, but remember, they are all slightly different with slightly different benefits, and you need to check on what those benefits are that are important to you. So that's A, B, and C. D is D for drugs. And the way the drug program works, it is actually changing in the year 2025 under the Biden Inflation Reduction Act. And we don't have any of those details yet. But what they want to do with that is to cap the out-of-pocket drug cost to $2,000 a year for each individual. Now, that may sound like a lot, but believe me, there are some drugs that are like $1,000 a month. So if you can get capped for $2,000 and then get all the rest of your drugs free for the year, that would be wonderful for some people. Insulin was capped a few years back, so people taking insulin know that they only have to pay $35 a month. But the way the other drugs work is that in July of every year, all the pharmaceutical companies get the drugs that they are going to make available to Medicare, put together a list of them, and then they send them to Medicare and they say, here you go, we're gonna offer drug A, B, C, and X, Y, and Z. And they give the list. They have to offer all of their common medications that are, very popular. They do not have to offer a $16,000 a month cancer drug. They do not need to make all of their drugs available to Medicare, but they do need to make the common drugs available. They give them to Medicare. Medicare enters them in their database. And then what happens is that the insurance companies, the ones that, the Medicare Advantage ones and the ones we looked at under Medigap, they come and they say, okay, let's see what we're gonna cover in our insurance plan. Okay, we're gonna cover A, B, and C, and X. We're not gonna cover Y and Z. And we're gonna sell them for, $10 a piece. And they load that information into their insurance files. And then all the pharmacies come along, CVS, Rite Aid, Walgreens, they'll all come along and they'll say, okay, what is being sold under Medicare that we're gonna have patients come in for? And they look and they go, okay, A, B, and C, and we're gonna add $15 on top of that for our markup. So everybody gets a little chunk, a little piece of it, except Medicare. Medicare is just the keeper of the information. And that's how the drug plans flow through. So what does that mean? That means if you have different drug companies and different pharmacies that are going in and charging whatever they want, it means that you have to have a specifically tailored drug program for you. So one of the big projects that we do every year at HiCap is to run drug plans for patients during open enrollment. And that lasts from October the 15th through December the 7th. And we basically take all of the drugs, the information from you, what dosage you use, how often you take them. We put all that information into the Medicare website, press a button, and it spits out every single possibility that you could have under Medicare for the drugs that you take. And we usually run a report that offers the 3 cheapest drug plans. And we put it together and then we discuss it with you and we tell you which one would be the cheapest one for you. Some people don't like to change. Some people, I work with a lot of older people that really reject change, and I've had people that I'll tell them if they were to shop at CVS, they'd save $150 a month on their drugs, but they don't care. They've been going to Jim's pharmacy for 20 years and Jim's wife bakes them banana bread at Christmas time. So if they want to keep going there, that's okay with me. We just give them the options of what they have that's cheapest. And that is how Part D works with regards to the drugs. If you are given a drug in the middle of the year, let's open enrollment, remember, ends December the 7th. And then that sets it up for January the 1st. So on January the 1st, you now have the WellCare drug plan, for example. And that plan covers, X amount of drugs at X amount of cost. What happens if your doctor comes in June and says, I got to put you on a new drug? If that drug is not in your drug plan, then you are going to have to pay full retail for it until the following open enrollment, which is going to mean next January, they can change. You can always ask for your doctor to write a letter to the drug plan and tell them that you want to add this drug to the formulary for the patient because he needs it and he can't, do without it. They'll review that and very rarely they'll come back and say, no, it's not covered. They pretty much will do it, but your doctor will have to fill out that paperwork for you and send it in. So that pretty much is the story for D. You can have coverage if you really need it. You can also get generics. The drugs are listed in the Medicare database in brand name and generic, so you can switch from one to the other. It becomes very expensive. But once again, the goal is to now next year get patients to just paying $2,000 out of pocket. So we'll see how it works. We don't have any of the specifics. We're gonna be training like crazy next month to figure out what's going on. But that is the picture of A, B, C, and D, and the Medigap supplemental plans. So are there any questions? If nobody has any questions,
No.
I must have answered all your questions. Good.
How can they make appointments with you? How can they make appointments with you?
Oh, you can call, the HICAP office, which is, the number is 805-477, 7100. And, you, will, just call, make an appointment. I actually work out of the Simi Valley Senior Center. And you can, make an appointment with me if you want to. If their HICAP office, the main office is in Ventura. So we have a lot of counselors here in Ventura that you can see. And then also we have someone in Ojai, that's in Ojai, someone in Santa Paula, and someone in Oxnard and Camarillo, and Thousand Oaks also. So we have a lot of people around who are able to help you. And we love doing this stuff, so we'll be glad to help you. We make appointments all year long. We don't schedule people that are just turning 65 during open enrollment from October the 15th through December the 7th, because it's just too crazy, so.
One question, if I have insurance through my work, do I still need to sign up by age 65?
Very good question. No, if you are insured with a group insurance plan at work, you do not have to sign up until you quit. Now, the minute you quit, you have 63 days in which you have to sign up for Part D and Part B. So you'll go to the Social Security office. That is where you get your A and B, at the Social Security office. And at that time, that's when they coordinate whether or not you're gonna have that taken out of your Social Security payment, because they know, they're the ones who handle all that. But if you're working, you do not have to have a plan until you leave. But you do have that ticking clock of that 63 days, so you don't wanna miss that.
During open enrollment, how difficult is it for people to get an appointment with you or one of your volunteer staff?
It isn't difficult with me at all, because I'll stay and work late with somebody. That's not a problem. But, there's a lot of people that are scheduled with, they have a different schedule than I have. I can work on the phone with someone if I have to, but during open enrollment, it's pretty hectic. We used to, in the old days, before COVID, we had a room that was filled with 40 people, and there was a line out the door, and it was really busy. It hasn't been that busy since then. I think people are now turning 65 that are very comfortable with a computer, and so a lot of them go online and they do things themselves, and they make mistakes, which they find out about later. So that is good that, they don't have to rush and worry about scheduling an appointment. But we try the best to get everyone in who needs an appointment. We'll work something out. And if we have to talk to them on the phone in the evening, we'll do that too, so.
You said 63 days to sign up for parts C and D. What about parts A and B?
A and B, you have to sign up with the Social Security office. So you have to have A and B first before you can get a supplemental plan and before you can get a Medicare Advantage plan. So those two are primary before you can do anything. And if you remember, I started the conversation out by talking about original Medicare. And original Medicare is people who only have A and B and don't have any supplemental plan and don't have a Medicare Advantage plan. So as long as you have A and B, you're in the Medicare world. And that's all your doctors need in order to see you.
you have any more questions, you're also welcome to email us after the webinar and we will send all these messages forward to Susan. There will be a recording of this webinar available later this week at alvina.org/webinars. And if there's any last minute questions, feel free to enter them in the chat or you can unmute yourself.
Thank you very much.
Thank you for coming in today to talk with us.
Okay.
Thank you, everyone.